Start with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And we'll go on with the roll call.
Dr. Dave Bardo.
Present.
Dr. Noel Deep.
Here.
Wayne Gagnon.
Here.
Jill Maddock Nelson.
Here.
Andy Mary.
Here.
Mary Neufeld.
Here.
Danny Pyatt.
Here.
J.D. Schrader.
Here.
Angel Zimmerman.
Here.
And we'll go on to board action, item
Mr.
A.
President, I would offer a motion that we open the floor for public comments. Since you have eliminated that process for the public to speak, I move that we open the floor for public speaking.
Second.
I don't think we can have a motion. Yeah, we can't have a motion that's not on the agenda, Danny.
Secondly, then, we need to not have this meeting because we don't have a consent agenda as part of this meeting. All we have is meeting opening and board action. We're not voting on a consent to agenda. We're not voting to approve this agenda. Isn't that supposed to be part of the agenda?
What rule makes you think we need that?
It's part of the agenda, JD.
Okay, if you would like to vote on approving the agenda, we will do that. And
So we're going
Mary-
to change the agenda now, 24 hours without a 24-hour notice?
we cannot change the agenda without a 24-hour notice. You could have notified either Julie or I if there was something you wanted changed on the agenda.
It was just this morning that I noticed the consent agenda was not on there, so I wasn't within the 24-hour notice.
We wouldn't change the agenda. If we change the agenda now, we wait 2 hours before we hold the meeting, just so everybody's aware of that.
Can I ask the reason why that we cannot have public comment in this meeting?
We'll discuss that when we bring the motion up.
Why can't we discuss that now? That's not part of the motion. Is it?
We did not post for public comment this evening because we are keenly aware of and confident that we understand the severe polarization that currently divides our community. Dozens of people have spoken publicly and sent emails, including in the last few minutes, to clearly state their position both for and against wearing masks in schools. In recent weeks, communications have overwhelmingly centered on asymptomatic students having to quarantine, lost instruction time, the confusion surrounding quarantine protocols, alleged inconsistencies in quarantining, the mental health concerns caused by quarantining, Nurse Jansen's job description, and the ineffectiveness of remote learning. Essentially, we are here tonight because so many are upset with our current quarantine protocol. All stakeholders have agreed that after safety, keeping students in school in effort to improve student achievement is our primary focus. In August, the board acknowledged public sentiment against wearing masks in school by voting to recommend wearing masks. A metric of hitting a 2% district positivity rate was ultimately suggested and approved before requiring masks. Our county data currently indicates significant spread, however. Lake County is currently at 15.78 positivity rate. This is calculated over 7 days by dividing the number of positive cases by the total number of cases tested, positive and negative, and multiplying that result by 100. 2 of our district students were hospitalized. I'm happy to report that one has recently been released from the hospital. At least 2 students in the state of Wisconsin have recently died with coronavirus. Over 900 of our district students have quarantined already this school year. Our legal advisor, insurance carrier, and state statute all indicate we should or must follow local health department protocols per CDC and DHS guidelines. As directed by the board last time we met with members of Langlade County Public Health on September 30th and agreed to a compromised protocol that resulted in tonight's motion. John Zankovich, Karen Martin, Dr. McKenna, Darlene Jansen, and I were present at that meeting. Tonight's motion is based on other health departments and districts' collaborative protocol, namely Green Bay's. For safety and liability purposes, Public Health will not endorse an amended motion this evening. Contact tracing under these new guidelines would still occur. Despite this evening's motion, also, parents, guardians, and caregivers can elect to have their asymptomatic close contact children quarantine at home if they wish. Close family and household asymptomatic contacts would still have to quarantine at home per the public health directive. So in other words, if a parent tests positive, the children would be told by the health department to quarantine, not by school. Symptomatic students must stay home or will be sent home. And if available, surgical masks are strongly recommended, but cloth masks are also acceptable. That is what brings us here tonight, and the reasoning behind no public comment on the agenda.
Thank you, Dr. Sprague, for having that prepared text to read for the question of no public comment. However, I wanted to point out that I believe not everybody in our community has had the opportunity, both for and against, to speak on behalf. So what you and what Mr. Mary have done is you have disenfranchised some of the voting constituency of the Unified School District of Antigo by not allowing public comment. Sure, we would have had some repeat people that we have heard from the past, but there could have been somebody that has not had an opportunity to be at one of the meetings in order to speak. So you have disenfranchised this community. You have disenfranchised, both of you sit at that table, and have disenfranchised the entire voting constituency of the Unified School District of Antigo. There's some statements that you made that I'll talk about later. There is some statements that you did make that I'll discuss at a later point because there are some inaccuracies of what you've stated.
I would like to make a motion if possible. I've prepared a resolution.
Unbelievable.
I think we better start with a motion to approve.
I'll second that resolution.
I'm sorry, I didn't hear what Jill said.
There is no resolution at this point.
When a member raises a resolution, all they need is a second, and they have to be heard.
Yeah, I think we're going to go back to your first point and approve the agenda. So if somebody would like to make a motion to approve the agenda?
May I do a point of order at this time, or do you need a motion first?
Do we need a motion to approve the agenda?
To add a motion to share a resolution. You need a motion for the consent agenda first.
If we want to change the agenda, we have to post that and allow a 2-hour period.
Right, so I was just requesting to offer a resolution.
What's the difference between a resolution and a motion?
I would share that with you.
Well, go ahead.
So point of order at this point is, is this a consent agenda, or do you want me to read my resolution?
We don't have a motion to approve the agenda, if that's what you're asking.
Mr. Mary, with all due respect, at what point are we at in this meeting? Are you looking to?
We're looking for a motion to approve the agenda.
Okay, so if we approve what's on here, somebody makes a motion and somebody seconds it, then we open it up to discussion, and then Jill can share what she what she would like to say.
If we
Is that-
approve the agenda, we're moving to item A, and we're going to have a discussion on that.
No, there'll be a point of order for the resolution for Jill to speak. She put it on the floor, and there was a second, so it must be heard. I will raise that point of order at that point, if you do not allow her to speak her resolution.
Okay, well, go ahead with your resolution.
Thank you. I have it prepared, so I will pass it out so that you can follow along as I read. Whereas it is the responsibility of the Board of Education to increase student achievement and provide a safe and healthy learning environment. And whereas, using the calculations approved at the August 24th, 2021 meeting of the USDA Board directly represents the school district population and the current presence of the COVID-19 virus within the district population. And whereas positive COVID-19 test results have not reached the 2% threshold since school started, with the most recent USDA COVID-19 dashboard data on October 3rd, 2021, reporting 0.71% active cases as a percent of total individuals. And whereas use of district data maintains consistency for district students, staff, parents, and stakeholders. And whereas a district-wide mask mandate would require visitors to wear a mask, including all visiting co-curricular districts, student participants, their district staff, and parents, guardians, caregivers of their children. And whereas using the USDA boundaries and population includes students from other counties attending USDA schools and does not include White Lake, Elko, Peace Lutheran, and All Saints School District staff and students. And whereas the calculations approved on August 24th, using USDA population, staff and students wear masks when active cases equal or exceed 2%, and remain masked until we drop to 1% and return to mask recommended and optimal, was in the original motion of 5% and 4%. And whereas quarantine measures of close contact students without symptoms removes equal access to learning. And whereas universal masking of healthy students have unknown impacts on academic achievement, to include limited to no research on adverse health impacts to students' overall health, to include, but not limited to, concentration struggles, respiratory impairments, headache, fatigue, depression, and anxiety, as well as academic barriers such as hindrance on speech development, nonverbal communication, and social skill development. And whereas the CDC COVID-19 weekly cases per 100,000 population by age and group Wisconsin graph shows since the start of the current school year to present, statewide transmission spiked on 9/18/21 with 433.7 incident cases per 100,000, with current data reported on 10/2/21 showing 90.1 per 100,000, which demonstrates a downward trend of transmission. And whereas, per American Academy of Pediatrics, children ages 0 to 17 years represented less than 0.3% of all confirmed deaths reported to the CDC. And whereas USDA does not have clear and convincing evidence to conclude moderate, high, or critically high transmission rates occur among USDA students. Therefore, be it resolved, the Unified School District of Antigo Board of Education promotes academic achievement through person-centered approaches, promoting health, safety, and well-being by understanding individual medical decisions require combined collaborative efforts with USDA, Langley County Health Department, and parents, guardians, caregivers. Therefore, be it further resolved, the USDA will continue to provide notification to parents, guardians, and caregivers when their student is identified as a close contact to a positive COVID-19 case. Therefore, be it further resolved, any student or staff member of the USDA population identified as a close contact to a positive COVID-19 case, regardless of vaccination status, displaying symptoms of COVID-19, be required to quarantine as identified within public health recommendations. Therefore, be it further resolved, the parent, guardian, caregiver of a student identified as a close contact to a positive COVID-19 case, regardless of vaccination status, who does not display symptoms of COVID-19, be provided the option to quarantine as identified within public health recommendations. Or, therefore, be it finally resolved, the parent, guardian, caregiver of a student identified as a close contact to a positive COVID-19 case, regardless of vaccination status, who does not display symptoms of COVID-19, be provided the option to continue in-person instruction and wear a mask, face covering for 10 days and monitor symptoms.
Okay. And you did a second for that resolution, is that correct?
Yes.
Yes.
Mary Kay, did you get a copy of that resolution?
I did not.
Jill, do you have another copy?
There's one over there.
Yes, so essentially, what I did was I looked again and continued to look at CDC data, the AAP, and again, verified that children in our district population are not at high risk. And we do not know the impacts of universal masking for those without symptoms. We do know that by taking students out of in-person instruction, that is negatively impacting their academic achievement. So by allowing students who are in close contact to a positive case remain in school given no symptoms, but remain masked, we are supporting student achievement by keeping kids in school as long as they do not have symptoms. We are also identifying that we as a district are seeking to work with parents and with public health on medical decisions that are best for their students. Again, the purpose of this is looking at what does our current data show, and our data trends are going down with less than 1% of our total district population being positive, and the overall focus is on increasing student achievement.
Any other comments?
When I brought this up last week at the meeting about changing the quarantine, the question I had and I still have is, what is the role of public health in this? If we pass this, can the public health overrule this and say that you'd have to follow the state statute? Where does that put the school district and the board?
My answer to that is yes, they can overrule, as recently identified by Medford. They wanted to go to the model that is in Jill's resolution, and public health said, no, you can't do that, so we'll take over quarantining for you.
So can I read the statute? With stat 252.03, there's section 1, I'll skip that. Section 2, local health officers may do what is reasonable and necessary for the prevention and suppression of disease, may forbid public gatherings when deemed necessary to control outbreaks or epidemics, and shall advise the departments of measures taken. If local authorities fail to enforce the communicable disease statutes and rules, the department shall take charge, and expenses thus insured will be paid by the county or municipality. No person may interfere with the investigation under this chapter of any place or its occupants by local health officers or their assistants. And then there is a little Attorney General opinion on the bottom. Although the Wisconsin Supreme Court decision in Palm is not directly controlling on the powers of local health officers under this section, it is advisable to limit enforcement under this section to ordinance or administrative enforcement. Also, local authorities shall ensure that any measures that direct people to stay at home, forbid certain travel, or close certain businesses speak specifically to local authorities' statutory powers under subdivision 1 and 2 to prevent, suppress, and control communicable diseases and forbid public gatherings when deemed necessary to control outbreaks or epidemics. So you would,
Well, that was my question last week, and I still don't have the answer to that. If we do this, now this was what I brought about the quarantining. Can we get the children back in school, not putting them through all this? And if they were masked and stayed in school and you repeated and you did the antigen testing at 3 to 5 days and they were negative and they remained asymptomatic, they could stay in school. But if we say that there's no masking requirement prior to that, and if public health comes and says that that is not right and they do what they did with Taylor County, do we lose what we have or what we are trying to achieve here? Then what is our recourse at that time? What happens if we do this and public health says that we are going to enforce the state statute, then what can the school district and the board do?
Dr. Sprague, I have a question. Do we have somebody who's employed by the public health here tonight, present? An employee of public health?
Not that I see.
Okay, then I have another question to follow up. Since we don't know if we have somebody that's employed, is there anybody employed by public health here? Okay. The question I have is the Langley County Public Health Department designed, this is going to sound like a dumb question, but I'm going somewhere with it. Is the Langley County Public Health Department designed to protect the public health of the entire Langley County? Yes or no?
I would assume yes.
My next question is, then, is the Langley County Public Health Department required to oversee all businesses, all schools, be it parochial schools or government-run schools or churches, any place of public where the public can go to? Are they to set the standard according to the statute that JD read? Are they to set the standard for all public facilities?
do you want me to read you the first section?
No, I'm asking Dr. Sprague.
I don't know.
The answer.
So then my next statement would be, why is it that on September the 30th, 2021, I was sent this morning, or actually, sorry, this afternoon, the protocol for quarantine at Peace Lutheran School that was approved according to them by the Public Health Department. So you're telling me that the Public Health Department approves one set of protocols for one school and then a different set of protocols for another school? I cannot see our Public Health Department setting protocols for different organizations because that would be inconsistent with all the different organizations around town. Plus, it would make their life a living problem because you would see how that would be a problem. You got one set of rules here and another set of rules there. I would think the Public Health Department would follow exactly what JD read, the state statute for the entire county of Langlade County. I do have copies of this.
What is it? I'm just
Like
curious
to
what
see
their
it.
policy is. It doesn't say they have to do the same thing everywhere. I mean, you could, I don't know, somebody would have to sue them and say
Of whose
equal protection
policy?
arguments or.
Whose policy?
No, what did they do for Peace Lutheran?
I'm going to pass it around to you because it was sent to me. Absolutely, take one and pass it around.
Dr. Sprague, when I asked that question, I think in our discussion, the response was that the health department could sue the school district for not following their recommendations. Correct?
I don't know about sue, but the statute language reads that if we are not following recommendations, they can take over essentially the quarantine protocol. And that's what legal advice to. Just so you know, we did discuss the protocol in your resolution with the health department.
How could you discuss that? You didn't know that resolution?
The same notion, Danny, that,
From Dave Bardo.
well, from the notion that quarantining is not palatable.
You're basing this on assumption that you talked to the health department because you didn't have the resolution in front of you, did you?
What I'm saying is, we discussed the notion of quarantining in school by wearing a mask. Patrick was there. Are you going to address that at this
Yes,
time? Thank you.
we did discuss that because that is something that,
Mr. Mary, I think we need to have this discussion with the board. The medical advisor has already advised our administration, and the administration can speak on behalf of the medical advisor.
I don't,
You won't let the public speak.
Yeah, he's not the public, he's our medical advisor.
Absolutely, and he
Dr. Sprague has
advises
asked
Dr.
him to
Sprague.
speak. I am asking him to speak.
We'll give him 5 minutes, like everybody else.
Patrick, your time is not limited.
so we spoke with public health and they said that they have very set guidelines.
Excuse me, Dr. McKenna, could you please turn your microphone on?
Absolutely. Can you hear me? Can you hear me?
If there's supposed to be a feed coming in, and I apologize, but I'm not getting it, Dustin.
Can you hear me?
We can hear you.
Okay. When we spoke with public health, they made very clear that they have a set of parameters that they need to adhere to quite closely. We discussed that Green Bay and other districts like Green Bay, when they had mask requirements, were limiting their close contacts and not requiring them to go home, but rather have them monitor for symptoms in the school setting. Public health was agreeable to that, but they indicated they would not extend further beyond that we could have a memorandum of understanding, which entails that, and then we could move forward as long as we required masking for a period of time. When that masking requirement is done, that understanding would also likely go away with that understanding as well. So just to speak to what Dr. Deep said, if we have a masking requirement, we would be allowed through public health to limit close contact quarantining in the context of individuals wearing masks who might be right next to someone who was symptomatic. Just as Dr. Sprague noted, family contacts would be a different situation, and of course, symptomatic contacts would be a different situation. The resolution you hold in front of you is a mishmash of ideas that are not endorsed by AAP, American Academy of Pediatrics.
I went
nor
directly to their
CDC.
website today. I'm not going to interrupt you, but I'm going to correct you because I went to their website today.
The resolution that you lay forward and the guidelines are not endorsed by
I believe Dr.
AAP
McKenna
or
is supposed to be
CDC.
addressing the meetings from the Public Health Department, not the resolution.
Oh, I'm sorry.
I think he has to address the resolution. The resolution is what we're talking about. If he has comments about it, I want to hear them.
Well, I'd like to hear some comments from these other people. But I'm not the president.
So certainly, from the medical advisor's recommendation would be to vote against the resolution. It is a mishmash of guidelines that are not under any sort of national, state, or local guidelines, would not recommend it. And I'd recommend moving forward and considering the motion that you have before you tonight.
Jill, can you cite your work for that resolution, please?
The information within the resolution is cited within the resolution. I have spent extensive time, Dr. McKenna, and I know that we frequently agree to disagree, which is why I just directly went to our data on our district website. I felt that data was consistent. It's easy to access. It's easy to understand. Parents, guardians, caregivers, stakeholders, staff, we can see it. We understand it. We're not doing per 100,000 or community Langley County number. We're looking at our district. It's insightful to hear that another school within Langley County can have different approving protocols from public health. I respect public health. I have no issue with public health, and I want to be very clear about that. And Dr. Sprague can verify this. I believe it was 3 weeks ago. I had asked Dr. Sprague, can we take our numbers, focus on student achievement, and ask the health department if they are willing to work with us to keep children in school that are close contacts but do not have symptoms? So to answer your, or to provide feedback, the information within this resolution, to not get into a scientific debate, but simply look at what does the CDC offer, what does the AAP offer, what does our district show, what is easiest and most efficient for our students and for our parents, and what also shows our district that we hear and we value the feedback provided by parents over the last 6 months, and that we want to work with them and with public health to keep students in school so that we can increase our student achievement.
Respectfully, there are no citations in this resolution.
The American Academy of Pediatrics is cited.
I believe,
So that
okay,
is
sorry, and the
not-
CD,
There are no citations. I apologize.
Correct. Yep.
And certainly, according to the guidelines you suggest, AAP, CDC do not recommend them.
your landmark study also shared that cloth masks provide little to no support with stopping the transmission, but yet here we are talking about masking district-wide. So I feel like we can go back and forth about what's right and wrong, but really, can we talk about student achievement and what's going to increase student achievement? I mean,
I think certainly the board, it would be very reasonable to move forward with voting on the resolution and the motion. And if you have questions about the motion when we come to it, I'm happy to answer it. I will say that we have an understanding, a memorandum of understanding with public health, that certainly this resolution will not change, how close contact quarantining is done in our school district. Based upon our statutory requirements, I don't, this is a non-starter.
that's where I go back to the question you
Well,
posed, Dr.
that's
D.
my question all along is, we can pass this, but if the health department disagrees with it, what can you do?
Well, what can the health department do, or what would they do, number one, and number two?
If they decide like Taylor County did, what recourse do we have to require this be the protocol to be followed?
Correct, and with Peace Lutheran and other childcare facilities in Langley County not having what is proposed to us, what makes us so much different that we cannot keep kids in school that don't have symptoms for close contact, but no other entity within Langley County is held to that. That's what I'm trying to understand better, with the focus on student achievement.
If I had had this Peace Lutheran, I apologize, I didn't know it was out there, but if I had had it and taken it to our meeting, I believe it would be an impossibility for us to cohort at the middle school and high school. We'd have to completely abandon our current schedules. And perhaps because Peace Lutheran can, that was enough of an impetus to have public health agree.
And so that would mean that perhaps they would agree to cohorting our elementary schools. But is there more comment here on the resolution?
I mean, there's after-school activities that kids congregate at that do not require masking, to include childcare facilities and other places in which our district students in high volume attend right after school. So as soon as they get off district property, their mask is off and they are still in close contact without a mask. So I am also trying to understand the realistic outcomes of this, by masking only at school, without knowing anything about the things that I've asked and shared with mental health and physical health and student achievement impacts. Is it reasonable to say by masking a student for 8 hours a day, but then they go to other facilities within Langley County at 3:03 p.m. and take their mask off, are we truly going to stop the spread or transmission if those same district students are in two locations, masked and unmasked, on the same day?
I think that is a really good point. I think if you have individuals after school who are in close contact with someone who has coronavirus, they will be required to close contact quarantine. And if they're wearing masks in our school, there will be the ability for them to remain in school. So you're actually in a situation where we're going to keep more kids in school if they're wearing masks. And we will avoid them having to be home for 7, 10, 14 days, whatever it ends up being. So it's a very good point.
Have we looked at White Lake and Elko? I know they don't require masking. But I'm just thinking within Lake County school populations.
I think the objective of the resolution is to keep as many children in school, keep them learning, and move forward with this. And then as the cases decline, have a clear boundary or marker for removing the mask requirement so that we can move forward with our lives. Kids don't have to be masked, and we can also keep them safe and in school. I think it's a reasonable...
Dr. McKenna? Dr. McKenna, I do have a question. We had those boundaries set with that was already voted on August the 24th, 2% and then 1%. And we have seen we don't know if what we just went through was a peak. It could be not. There could be another peak somewhere. But now we see 13 cases as of today within our school district. I saw where Nurse Jansen updated the dashboard today with, I think it was 13 students and 3 staff members that's on the dashboard today. Please correct me if I'm wrong with that number.
I'm sorry.
But we've already set that benchmark, so why do we want to move the goalpost and look at the entire county whenever the entire county is not inclusive of the Unified School District of Antigo, because we are not counting the students and parents that live in Shawano County or Marathon County. And then when we look at the entire Lake County, we're including White Lake and Elko. And you understand? I know.
Yes.
You know
Do
what
you
I'm thinking
wish
here.
for me to comment on this?
I would like to comment on cases
Oh,
going down because it does present as though cases have been going down. On September 20th, they were 40. The 29th, they were 25. Currently, they're 16. So that trend seems to be going down within our district specifically.
So,
And
Pastor
one more
Pyatt,
thing
you were
before.
saying, I'm sorry.
One more thing too. If we're saying requiring masks and that's going to help, I challenge you to look at all the school buses that are driving around town. You will probably find that 95% of the students on those buses, as I'm driving around town, are not wearing a mask.
Oh, wait, I'm sorry, Pastor Pyatt, when you are the person on the bus, you are not asking students to wear masks? Aren't you required by federal?
I do not drive a school bus.
Oh, I'm sorry.
I'm the supervisor for public transportation, total different company. I have nothing to do with the school busing in Antigo for the Unified School District.
Oh, I'm sorry. So when you see
But
buses
when
go
I
by.
see, I was off 2 days and I sat on my front porch right next to the middle school. 3 buses went by. Not one student was a mask.
Was the driver?
So,
No,
on the driver was not?
no.
Okay. Well, Pastor Pyatt, you mentioned about the guidelines that you came up with in August. As the medical...
I didn't come up with those.
I'm sorry, as
board
the
did.
board, as the board came up with them, I was strongly opposed to them. I said they did not make sense. I said they would not prevent us from
We know
having
what you said.
students
We
out
were
of
here
school.
and heard what you said,
Well,
that you opposed them.
You asked me about this, so that's why I'm commenting on it. And currently, we've had a number of students out, and we would like to have more students in school and do our best to keep students safe and to move forward with education.
And
So
that's what this resolution will do.
That's why we're suggesting this resolution.
Yes.
So, okay,
I have
Oh,
one
not the
more.
resolution, the motion.
I guess I still,
JD is not on the floor? Is that what you're saying, that he can't speak?
I was just trying to ask about the language of the resolution. I like Dr. Deep's idea. Jill, which one of those last 3 paragraphs is the non-asymptomatic close contact?
Non-symptomatic close contact. Not display symptoms, second to last.
Second to last. It's
Uh,
that the
and last.
parent of a student identified as a close contact to a positive case who does not display symptoms be provided the option to quarantine. Do we got to, if we want to vote for that, do we got to change the language to say that the student, right, it's kind of, you say that the sentence is backwards?
I don't understand what you're saying. Can you explain that, JD?
Well,
The parent is the one identified as the close contact. It's like we're trying to quarantine the parent, not the student.
yeah, well, I understand what you're saying, and my intent when I wrote that was the parent, guardian, caregiver of the student would be provided the option. So, yeah.
Okay, any further comments on this resolution?
Just to clarify, we do not know then, or we do know, the parameters of the health department, what the recourse could be.
They could sue us. I don't know what they could do, send the police.
I don't know that they could do anything because they say, okay, for Peace Lutheran, for one thing, they don't even wear masks, are not recommended in the building of the health department.
I'm not opposed to trying it. It's not, I thought we were coming here to decide, should we not mask or should we not quarantine? If we
Well,
could,
this resolution will supersede
I see that, but we got to
motion.
fix the language then in this sentence. It doesn't, because I don't understand the end either. We're provided the option to quarantine as identified within public health recommendation. What does that part mean, Jill? Is that like, if public health still says quarantine, they can still make us quarantine?
So that means the option, the parent, guardian, caregiver would be provided the option to continue to follow whatever the current quarantine recommendations for close contact, no symptoms are from the public health. Or they would have the option to allow their student to attend school wearing a mask for those 10 days and monitoring symptoms. So they're provided the option, showing that we still respect and seek to have strong rapport with public health within their recommendations, while also allowing parents to ultimately make the decision of what is best for their student. And if it's best for their student to remain in person, then they can attend in person wearing a mask and monitor symptoms.
So if I understand correctly, the only difference between the resolution and the motion is the length of mask wearing. Motion says everyone wears them starting Wednesday. This resolution says they're still recommended, but that asymptomatic close contacts would wear them for 10 days once they're identified as?
Yes, an identified close contact of a positive case that does not have symptoms, if they were to choose the option of in-person learning, would simply wear a mask for 10 days and monitor symptoms.
Which section are you reading, Julie?
The last
Can I ask
part.
if Dr. Dave Bardo is still with us to make sure he's not lost somewhere?
Dr. Barter, are you with us?
I haven't heard him breathe.
No.
He's not.
So that's like Dave's motion, or Dave's idea last week.
Yeah,
But I think there's another difference between what you have here, Julie, and what Jill presented is you're talking about the mask, but she's not, that's the other difference. There's no initial masking. There's no universal or requirement for masking. That's another difference. It's post-exposure masking.
right.
All right, Dr.
Mask-
Bardo said he was kicked out, but we got him now.
I'm going to try to reconnect.
You got him back?
Are you going to have me there?
My question is, so
Just
who's
stay
going to
on speaker.
enforce that the kid's wearing a mask when they come back to school? And what behavior issue is that going to cause?
We discussed that as well. The part about universal masking is obvious. This resolution, it would have to be on a student's honor, because for any staff member to keep up with the daily change in close contacts, that's just an impossibility. So we would have to rely on students.
And as well, I believe the resolution speaks to post-exposure masking. There's no guideline in CDC or anywhere that suggests or recommends that as a means of quarantining individuals. Certainly, if you've been exposed and vaccinated, you can wear a mask. But there's, again, the resolution also points to.
Oh, it's going to give us kickback.
Dr. Bardo, are you on the call with us now?
I believe I'm back on.
Thank you.
Did you hear me?
Yes, we can.
Did you hear me?
Yes, we
Dr.
did.
Bardo? No?
Yes, we can hear you. Can you try and talk to him there, Mary Kay?
I think we lost him again.
Oh, Lord.
Mr. President, can I say something to celebrate with one of our board members?
Mary Kay, I was kicked out a second time, but I believe I'm back on.
Yes, we can hear you.
Okay, thank you.
Okay, so we will, Dr. McKenna, you were in the middle.
Can I say something for celebration?
I'm going to get it.
Feedback.
Feedback.
Mr. President, can we celebrate with one of our board members while they're trying to reconnect Dr. Bardo and with Angel Zimmerman and her great news that she is cancer-free. Angel is cancer-free.
Thank you, Brian.
I do want to add that I think she's only missed maybe 2 meetings through all of this, so
Yeah.
thank you, Angel, for your
Yeah, my head's been a
determination.
little foggy, so I'm playing catch-ups here, but we have a lot of work to do, but.
We're glad you're here.
Congratulations, Angel.
Thank you.
I do want to add that I think she's only missed maybe 2 meetings through all of this, so. Yeah, thank you, Angel.
Yeah, my head's got a little foggy, so I'm playing catch-up here.
Yeah. It's slower than me.
Why am I like?
I'm built for comfort, not speed.
I had to mute Dr. Bardo. He's speeding back. So he is in the call, but he is muted at this time. He can unmute himself if he needs to.
He can unmute himself?
Yeah.
Okay. All right.
Could we just have a little test of that? Dr. Bardo, could you unmute yourself and so we know that you could speak to us?
It should be Dr. Bardo, there should be it should tell you what button you have to press to unmute your microphone.
So we don't know if he can actually hear us right now?
Technically, no.
We can't have him on the phone because we get too much feedback, unless you have another way of calling him.
Can we do the Google Meet?
That's what we're in right now. But if we want it over the speakers, no. Like a cell phone call or something like that, is that like allowed?
Work?
So Dustin, if you could get him on a cell phone call or on a call, and then you would have to speak up and tell us if he has something to say, and
Then hold the phone next to a microphone?
will that work, to hold the phone next to a microphone, or will that?
I think you'll get feedback.
Probably feedback like it is right now.
Then I think all we can do is you would have to relay his message to us, and you can ask him if you can get him online, if that is acceptable to him.
Sure. We have his phone.
What about FaceTiming? I know, I remember. Can we FaceTime him with a phone and put him up on the,
Hi, Dr. Bardo. This is Dustin Racine, IT surgeon. Oh, okay. All right, so you can hear them, and you're going to be... Okay, on this phone call, you'll say it. Okay. All right. Okay, I think we're good. He can hear you.
use our lifeline?
When there is a motion, he will
Use a lifeline, that's the only thing.
have the vote. I'll put it on speakerphone so everybody can hear it. That sounds okay.
Yes, I think that's the best we're going to do tonight.
All right. Thanks for your patience, Dr. Bardo.
Okay. Then we will go on. Is there any further discussion on the resolution here?
Do we want to hear from Angel or Mary or Wayne on the resolution?
Do we want to what?
Any of you guys want to say something on this? Any of you who haven't said anything? Angel, Mary, I think you were about to say something, Angel.
I don't know.
I would have some questions for Dr. McKenna, not necessarily relating to the resolution. I'd like to ask him, at this time last year, we had fairly low transmission rates. Right now, their transmission rates are significantly higher. From the research you've conducted, how big a role is masking playing in what we had last year compared to what we have now?
It certainly is playing a role. And when you look at the data regarding places where masks are being worn, where they're not, they do have lower transmission. The Delta variant is also more contagious, so we also know that that does also play a role in this. but certainly masking has an impact. We've had in-school transmission, which we did not have at all last year, and so it's very clearly relevant.
Factors that I also think play a role, I believe there's an 82% difference in-person learners this year than last year. Been very open, I don't do math, but it's 1,017 students, I think, difference from last year to this year, so that would play a role. Delta, as Dr. McKenna has shared, is more contagious, though in a parent email, this did jog my memory of feedback that the variant would spike and go down quicker. So perhaps the data is showing that it is on that going down quicker component of things. I would also say that factors that also reflect positive cases would be that last year would have been, first quarter would have been the second consecutive school quarter of quarantine, of COVID. So people reasonably had less information and were more proactive in staying more isolated as family units, masking generally in public. We are now at the sixth consecutive school quarter. So I think that plays a difference in addition to other schools within our county not masking. So there's different variables of transmission also.
And Wayne, if you look at this year, for example, the Green Bay School District, they've had much less quarantine as a percentage and less transmission as a percentage than we have.
And they are masking?
Yes.
Okay.
Yeah, and it would be interesting maybe for follow-up to look at White Lake and Elko. I don't believe either of those schools require masking. In fact, I know for certain White Lake does not. And I don't know what the county health department has agreed to with those two in terms of close contact, no symptom quarantining. So maybe that could be follow-up that we can do with those districts within Langley County.
So Jill, you would think that if the county health department is wanting us to set this mask mandate at the Antigo School District, they too are also part of the Langley County. They would set that mandate for the White Lake and Elko School District.
I would not like to speak
I
on
know
behalf.
you can't speak on that, but it stands for reason. If it's a county health department, their rules are going to be required countywide, not just for picking and choosing.
I would just remind the board that you asked us to meet to see if we could come up with a way to improve students staying in school. And so we found time on short notice to do that, and we did that. And that's why we met, to come up with those guidelines and to try to make an effort to keep more students in school.
Which is very much appreciated, and I did request that the full board be invited to that meeting as well. Unfortunately, we were not, but I do share that feedback as well, that we are all invested and we appreciate the time. And again, I'll be very clear, I respect and support the health department. I have nothing against the health department at all. I think the concerns shared by our parents are meaningful and impactful. And how do we support student achievement? We know that kids being out of school, if they have no symptoms and are healthy, is impacting our student achievement. So I'm hopeful that we can respectfully come to a resolution that keeps our children in school if they do not have symptoms, while also respecting masking if they are in close contact without symptoms.
So you're calling this sort of, if we vote on and pass this, you're kind of calling it a counteroffer to the county because they might or might not ignore us?
I personally believe that there should have been an employee from the county health department here that we can ask some of these questions to. The resolution that Jill has provided will provide students to be back in school for student achievement. It will provide the parents, who is the caregivers, the one who birthed these children, the decision to keep their kids in school, or they can quarantine them at home. And it also provides the latitude for the school district and for Nurse Jansen to say to a child, instead of quarantining, you wear a mask to come to school for the next 10 days. This resolution provides that.
I mean, I think the resolution's a fine idea. I just don't know what's going to happen.
Well,
Here.
certainly, we will proceed with our memorandum of understanding that preceded this, which means close contact quarantining as currently the Board of Health requires.
So are you speaking on behalf of the Public Health Department and stating, I guess I'm confused on that right now.
Yes. We met, yes.
I'm not, no disrespect, that was very unclear.
I'm sorry, I couldn't hear you. I'm sorry, Joe. What did you say?
I just said, I asked that very respectfully because it was very unclear to me. When
We
you
met-
stated we would be following the MOU.
So we met as a group on the request of the board to see if we could come up with a memorandum of understanding that involved keeping students in school with and being able to minimize close contact quarantining in the context of masking. And so when we discussed that with the health department, they indicated the motion above would be acceptable to them. If your resolution would not be acceptable to them. They made that very clear, that alternative pathways and routes would not be acceptable. So we would continue to work from our memorandum of understanding with the health department and continue as we have been. And that is what we
I
would do.
still cannot get my mind wrapped around the health department saying, this district can do this district or this school, Peace Lutheran, can do this, with no consistencies across the whole entire Langlade County.
I do not agree with that, Pastor Pyatt, and we could argue this all night, but I think we'd be better served to direct our superintendent to go back and our medical advisor, go back and discuss this with the health department as opposed to trying to force them into something. And we don't want to be at odds here, in my opinion. We should be working together. You know, we're both in this community. The school district is part of this community. The health department is part of this community. And so when you try to tear it apart, I don't see the purpose served.
Why don't you have a meeting on a Monday night when the health department can be here to speak for themselves? This whole meeting's out of order. Nothing happens on a Sunday night.
When we talked with the health department about,
Can the officer go over there? Can the officer go talk to him?
Mr. Mary,
The officer's here for a reason.
Mr. Mary, I do want to say, on behalf of what we just heard from the audience, I did want to ask the question is what happened to the sacredness of Sundays? Prior to my coming on this board, and then coming on this board, I was told and informed that there will be no meetings on a Wednesday or a Sunday because of all the religious activities around our county. I think it's very disrespectful of Dr. Sprague and you to have this meeting on a Sunday. So if we're going to take this resolution back to the county health department, I would say that the entire board can be present at that meeting with the health department if they choose to be.
that's a walking
Listen.
forum, though, Danny.
It can be posted. The board can be present, and the board and Mary Kay can post it that there's no action taken at that meeting. There's other school districts that have board meetings and have board functions all around their community, and the secretary just posts that the board there may be a quorum present, may not be. When we go to state convention, there may be a quorum present, but there's no action taken. I would say that we need to have the entire board there if they choose, if they want to be. Maybe nobody will show up, I don't know.
I just want to
be
reiterate
there.
that the option in the resolution, we did have a discussion about that, and the health department was not on board with that.
Did the
Dr.
health,
Sprague, I think the board wants to hear it for themselves is what I am understanding from this discussion. I think we should table this until either we have the health department come here, okay? And you post it as a meeting that the health department director or whoever the representative is can sit here with us and tell us that you guys do this, we will institute the statutory requirement and we will hold you responsible, we will take over the quarantining, okay? That is what when I brought this idea up last week, my whole reason was you have 975 students who have been quarantined at home in the past month. You are also looking at the parents of those 975 kids. At least half of them might be the elementary school age where the parents have to stay home. This is a blue-collar community. People can't afford to be home taking care of their kids and providing for their education. So I'd like to have a resolution for this issue. The quarantine needs to change so that asymptomatic kids can come in, and if we have our antigen testing in place in the near future, offer the testing at 3 to 5 days to the asymptomatic children, keep them in school. The whole discussion point here, in my opinion, is masking before or after the exposure. That seems to be the point of contention. And so I do not want this discussion to proceed any further without hearing from the health department if they will override whatever we do here. There is no sense in, I can sit here till 10 o'clock, I don't mind. But whatever you do tonight, if the health department is going to disagree with that, what have we achieved? Tell me that. All of us have taken time off from our busy schedules, from our families, from whatever reason, but what are we achieving at the end of tonight? Are you going to do something that the health department will overrule potentially? And again, I'm not saying they will, but then you're back to square one. And what happens if they put everything back in? I need some answers from them before we vote on this. Either all of us go meet with them or have them come to our meeting, and we'd like to hear from them what their point is. What is their, will they agree to what's presented here? You have this in writing now. You can take it back to them and say, this is what we have. Will you agree to this? And if they say no, and what are they going to do? Do they have the manpower or the powers that be behind them to start enforcing or sending out orders like they did in Taylor County? And then we have to be prepared. And then that's another question that you need to have for our insurance carriers. If we disagree with that, what happens? I need those answers before I vote on it.
So as the person who seconded that motion, I agree and concur with what Dr. Deep has just said. We have a lot of questions for the health department, who should have been present tonight. So Dr. Sprague, I agree, and I would hold this resolution, give the resolution to the health department, and let them come here and let's discuss this resolution before we proceed.
Make a motion to postpone to time certain.
I make a motion to adjourn this meeting.
We didn't hear
Dr.
you.
Deep, would you repeat?
I made a motion to postpone this resolution to a time certain.
I'll second that motion.
Can you make the motion to
Postpone this discussion to a time certain.
the whole
which would be-
thing, so we get the next agenda item postponed as well?
Yes, this whole thing is postponed, or I don't want to table it, I'm just saying I'm postponing it to a time certain, which is a higher order and takes precedence over whatever resolution you're discussing.
I understand your motion, Dr. Deep,
Thank
and
you.
I still second it.
Thank you.
Thank you, Dr. DB, I appreciate that.
Okay, any further discussion on the motion? We'll do a roll call on that motion.
Dr. Dave Bardo? The motion is to postpone this meeting until discussion with the public health. We can hold a discussion with the public health department.
Yes.
Is that the motion that you have, Dr. Deep?
That is
Is that correct?
Yes.
Action.
And you voted yes? Dr. Deep?
We can,
Yes.
Gagnon?
Yes.
Maddox Nelson?
Yes.
Newfeld? Hyatt?
Yes.
Schrader?
Yes.
Zimmerman?
Yes.
Mary?
yes.
I make a motion, we adjourn this meeting.
Second.
Is there a second? To adjourn?
Yeah.
Yep. Okay.
Jill.
All those in favor?
Aye.
Aye.